Hello friends, this video is on clotting tests. Particularly the focus will be on prothrombin time and activated partial thromboplastin time, commonly called as APTT. Very often second year students, when they read pathology, they don't understand these tests very well. So this video is as much applicable to the second year students as well as the first year students. Even they will require these tests in their hematology section. So let's start with the basics. When do you need the tests for clotting? When do you have to perform these tests? We will be focusing on three tests actually: the clotting time, the PT, that is prothrombin time, and APTT, activated partial thromboplastin time. So when do you require to perform these tests? Two clinical situations when you require these tests. One is when clotting is abnormally prolonged because of some defect, because of some deficiency of the clotting factor. So you would like to check the clotting mechanism and thereby you perform the clotting tests. So inherited deficiencies of clotting factors and clotting is prolonged, or in certain situations where you prolong the clotting deliberately. Like there are certain clinical conditions in which clot is abnormally being formed, as we will see later, and you give drugs to prolong the clotting, and therefore you want to see whether your drug is working fine or not. Even then you will require to perform these tests. So two types of clinical conditions in which you perform these tests. A, when the clotting is prolonged because of some clotting factor deficiency, or B, when clot is abnormally being formed, you give drug to prolong the clotting, and therefore to check whether the drug is working, whether clotting time has been prolonged, you will perform the clotting tests. If you look at the basics, a clot is formed in one of the two ways, extrinsic pathway and intrinsic pathway. In the extrinsic pathway, it is triggered by the tissue thromboplastin. And tissue thromboplastin, I have just written it in a shortcut so that you understand, we'll focus on a few things. Tissue thromboplastin, then in the presence of factor 7, there will be formation of prothrombin activator. In the case of intrinsic pathway, it is triggered by contact activation of factor 12. And then there is presence of high molecular weight kininogen and prekallikrein, etc. So, but the initiating factor is contact activation of factor 12 with platelet phospholipids, etc. And in the presence of factor 8 and 9, there is formation of prothrombin activator. So at this point, I want you to remember factor 7 for extrinsic pathway and factors 8 and 9 for the intrinsic pathway for coagulation. These factors are required in these two pathways, and there is formation of prothrombin activator. Now this is the rate limiting step. Formation of prothrombin activator is the rate limiting step. Means once it is formed, whatever time taken for the formation of prothrombin activator, once it is formed, then the subsequent steps will follow very, very rapidly, like formation of thrombin and then finally formation of fibrin. So our focus will be to check how much time was taken for the formation of prothrombin activator. Subsequent steps, they follow very rapidly, very few seconds, very rapidly, almost instantly. And therefore, we will be assuming in these tests that once the prothrombin activator is formed, the subsequent steps would take a few seconds here and there, and the clot will be formed. And therefore, we will also assume that fibrinogen levels and the subsequent factor levels are normal. So our focus will be to see how much time was taken for the formation of prothrombin activator by the extrinsic pathway and by the intrinsic pathway. So aim for both pathways is to form prothrombin activator. That's clear now. And once it is formed, the clot is formed very quickly. And therefore aim of the clotting tests is also to see how much time was taken for the formation of prothrombin activator, as we will see in the subsequent discussion. that the aim of these tests is to see how much time was taken for the formation of prothrombin activator. Now, there are two tests, actually three: clotting time, that's simple to understand, but then prothrombin time and activated partial thromboplastin time. So our focus is on the second and third one, that is PT, prothrombin time, and activated partial thromboplastin time. Prothrombin time will check the formation of prothrombin activator by extrinsic pathway, and the APTT will check the formation of prothrombin activator by intrinsic pathway. So let's understand in little more detail. There are vitamin K dependent factors 2, 7, 9, 10. Now concentrate on the factor 7. Where was it required? It was required for extrinsic pathway for coagulation. It's a vitamin K dependent factor. And as I mentioned, under certain conditions, you give vitamin K antagonists. Vitamin K antagonists will block the action of the vitamin K dependent factors, and particular focus on factor 7. So vitamin K antagonists are given to prolong the clotting in certain situations where there was abnormal clotting. And then how to assess the efficacy of these drugs? You have given vitamin K antagonist. Now you want to know whether the drug is acting or not, and how efficient the drug is. So here you will have to perform certain tests, and that test is the prothrombin time. Prothrombin time, PT, checks the formation of prothrombin activator by extrinsic pathway. And in that extrinsic pathway, you need one vitamin K dependent factor, that is factor 7. So if you give vitamin K antagonist drugs, it will block the factor 7, and thereby it will block the extrinsic pathway, or it will prolong the formation of clot by extrinsic pathway. So this test is done for that purpose, and therefore in this test we will be using tissue thromboplastin. Please remember, we are checking in the prothrombin time test, we are checking formation of prothrombin activator by extrinsic pathway, and therefore as we saw, extrinsic pathway is triggered by tissue thromboplastin, and therefore in this test we will be using the tissue thromboplastin. Now next, factors 8 and 9, as we saw, factors 8 and 9 are required, they are critical for intrinsic pathway of coagulation. And there are certain diseases in which there is deficiencies of either factor 8 or factor 9, and if that is the case, then clotting will be prolonged. Clotting by intrinsic pathway will be prolonged in the deficiency of factor 8 or 9. For instance, hemophilia, anti-hemophilic factor or factor 8, if it is deficient, the disease is called as hemophilia. Christmas disease, if there is a deficiency of factor 9, and factor 8 and 9 are required for clot formation by intrinsic pathway, as we saw, and therefore for that pathway we have another test, which is APTT, Activated Partial Thromboplastin Time. This test will check the clot formation, prothrombin activator formation by intrinsic pathway, and therefore we will not use tissue thromboplastin in this test. So first test, prothrombin time, was with the use of tissue thromboplastin because it was checking extrinsic pathway of coagulation and factor 7. And this test, the APTT, will be without using tissue thromboplastin because it is checking the intrinsic pathway of coagulation, mainly checking for factor 8 and factor 9 because we are checking for the diseases like hemophilia or Christmas disease. So that being said, let's look at the tests one by one. There are three tests, important tests, which are performed as I mentioned at the start: clotting time, prothrombin time, and activated partial thromboplastin time, APTT. Clotting time is easy, so we will not spend much time on that. Clotting time, there are two methods by which you can perform the clotting time test. You must have done it in the laboratory already: capillary method and test tube method. So in the case of capillary method, you fill the capillary up to 2/3 and then break it at every 30 seconds interval till you see the fibrin thread. That's a capillary method for clotting time. And then test tube method. You will collect the blood sample and by intermittently rocking the test tube or tilting the test tube, you will see whether the clot is formed or not. As long as the blood is in the liquid state, the blood will flow as you tilt the test tube, and then at some point the clot has been formed. So when you tilt the test tube, the blood will not flow. It will be solid. The fibrin thread has been formed. Normal values 4 to 11 minutes in the test tube, and 20 to 60 minutes if you are using siliconized tubes. Siliconized tubes, they prolong the clotting time, and therefore 20 to 60 minutes in the case of siliconized tubes. Well, that was easy and you must have performed these tests already. Let's go ahead and now talk about the prothrombin time, PT. Now the first thing, we are checking the clotting mechanism by extrinsic pathway. By extrinsic pathway, formation of prothrombin activator, and then the subsequent steps follow, and we assume that fibrinogen levels etc. are already normal. So prothrombin time, also called as Quick's one-stage procedure or Quick's one-stage test. It was developed by Armand J. Quick, so it's called as Quick's one-stage test. And why it's called one-stage test? Because in a single step we will be generating or triggering the clot formation. Just one step procedure, and there will be formation of prothrombin activator in just one step. So it triggers clotting process in a single step. And yes, the name is misleading actually. The name suggests that we are checking the prothrombin levels, or we are checking the formation of prothrombin activator only, or prothrombin levels only. That's not the case. Name is misleading. It does not just test the prothrombin, which is the factor 2, but it tests deficiency of several other clotting factors as well. And I want you to focus on factor 7 here, because it's a vitamin K dependent factor, and we will be giving vitamin K antagonists to prolong the clotting, and then we will see how much the clotting time has been prolonged in this particular test. Okay, this test is done to assess the extrinsic pathway for coagulation. We already mentioned that, and therefore obviously we will be using tissue thromboplastin, because tissue thromboplastin triggers extrinsic pathway for clotting. Now how is the test performed? We will collect the patient's plasma. It's the oxalated plasma, oxalated blood, and then we will be mixing it with tissue thromboplastin and calcium, or adding tissue thromboplastin and calcium to the patient's plasma. Now the patient's plasma has got clotting factors, yes, and we add tissue thromboplastin and calcium, so it is going to trigger the process of formation of prothrombin activator by extrinsic pathway. All right, so tissue thromboplastin activates factor 7. Factor 7, yes. All other factors are quite common to both pathways, but factor 7 exclusive for extrinsic pathway, factors 8 and 9 exclusive for intrinsic pathway. Therefore, I want you to focus on these two factors. Factor 7 for extrinsic. Okay, so thromboplastin activates factor 7, and then coagulation cascade is triggered. You will use stopwatch to measure the time taken for formation of prothrombin activator. Once it is formed, then prothrombin will convert to thrombin, and then fibrinogen will be converted to fibrin, and the levels of fibrinogen, as I mentioned, are assumed to be normal. Now the test measures concentration of prothrombin, factor 2, and also factors 5, 7 and 10. Factors 5, 7 and 10. But other factors like factor 10 will also be required in the intrinsic pathway. What is exclusive for this particular pathway and this particular test? Factor 7. So we are exclusively checking the factor 7, and when we give a drug, and the factor 7, which is the drug is vitamin K antagonist, and the factor 7 is vitamin K dependent factor. So factor 7 will be inactive, and therefore the extrinsic pathway will be prolonged. The clotting time will be prolonged by the extrinsic pathway. That's the whole idea behind it. Okay, now the result, normal prothrombin time is 11 to 16 seconds. How do you mention this result? Prothrombin time of the patient's plasma is compared with that of the normal plasma. So it's compared with the normal plasma, and the result is mentioned as INR, International Normalized Ratio. But at this stage, what you can remember is a normal prothrombin time. So in summary, you took patient's plasma, you added tissue thromboplastin and calcium, and then how much time the prothrombin activator was formed by the extrinsic pathway, that is being checked here. And remember factor 7. Alright, prothrombin time is normal in hemophilia and Christmas disease. Now this is very obvious. Hemophilia, deficiency of factor 8. Christmas disease, deficiency of factor 9. And these 8 and 9, these factors are required for intrinsic pathway of coagulation. And we are checking extrinsic pathway when we are performing prothrombin time, and therefore it will be normal in these diseases. Factors 8 and 9 are not required in the extrinsic pathway. Prothrombin time is prolonged in the deficiencies of prothrombin, that is factor 2, as also factors 7 and 10. Factor 10 is required in both pathways. So factor 7 is very crucial for this particular test. So focus on that. These deficiencies occur due to vitamin K deficiency. These are factors 2, 7, 9, 10. These are vitamin K dependent factors, as I mentioned already. And therefore, in the vitamin K deficiency, these factors will not be functioning normally. They won't get activated, and then the prothrombin time will be prolonged. Extrinsic pathway of coagulation will become abnormal. But the question is, when is it that the vitamin K deficiency occur? Well, in the liver condition, severe liver diseases, there can be vitamin K deficiency. And why is that? It's because liver secretes bile, and bile salts are required for absorption of fats and fat soluble vitamins. Vitamin K is a fat soluble vitamin, and therefore in the severe liver diseases also there will be vitamin K deficiency, and that means the prothrombin time will be prolonged. Severe liver diseases, remember. Now coming to the clinical application. Now there are certain situations, there are certain conditions in which there are abnormal clots triggered. Remember the clinical situation where we will perform prothrombin time. Myocardial infarction, abnormal clot triggered in the coronary artery, deep vein thrombosis in the legs particularly, and then it is detached, it comes into the pulmonary circulation, so it's called pulmonary embolism, or prosthetic heart valves. Now these are the conditions in which abnormal clots are triggered, and therefore you give drugs to prolong, inhibit that abnormal clot formation. So oral anticoagulants will be given so that this abnormal clot formation is prevented in these clinical conditions. Now you give coumarin derivatives like warfarin. It's an oral anticoagulant. These are vitamin K antagonists. I think I have already mentioned it, that coumarin derivatives or warfarin is a vitamin K antagonist. You give vitamin K antagonist to stop the vitamin K dependent factors which are triggering clotting, and in these conditions clotting is abnormally triggered. So you want to prolong that clotting, prevent that abnormal clotting. You give vitamin K antagonists. Warfarin, remember. How is this therapy monitored? How will you monitor that your drug is acting and it is working fine, it is working to the benefit of the patient? How do you monitor that? prothrombin time will be performed. So monitor the prothrombin time at periodic intervals. Monitor the prothrombin time. It should be prolonged to about twice the normal value. So when you give drug, when do you know that the drug has started acting and the clotting has been prolonged? It is when prothrombin time becomes almost 25 to 30 seconds. Remember, the normal range was 11 to 16 seconds. And now, when you give vitamin K antagonists like this warfarin, you expect the prothrombin time to get at least doubled or more than double, 30 seconds or even more. So if prothrombin time is 25 to 30 seconds or even more, you know that your drug is acting. Therefore, it has stopped the vitamin K dependent factors 2, 7, 9, 10, and particularly factor 7, because it is exclusive to the extrinsic pathway, and therefore your drug is acting and stopping the abnormal clot formation which occurs in various conditions. So that was the prothrombin time, how it is performed. It's a single step procedure. Clot was formed in a single step. Just addition of tissue thromboplastin and calcium to the patient's plasma. That's it. One step, and then prothrombin activator formation was checked and the normal time is seen. Alright, with that, let's now talk about the next test, and that is APTT, Activated Partial Thromboplastin Time. Let's understand the name itself, but before that, this test checks the clotting time by intrinsic pathway. The other test, PT, was for clotting by extrinsic pathway, because it was checking the factors which are involved in the extrinsic pathway for coagulation, factors 2, 7, 9, 10, and particularly 7, which is exclusive for extrinsic pathway. Now this test will be checking clotting by intrinsic pathway for coagulation, and more focus will be on factors 8 and 9, because these factors 8 and 9 are exclusively used in the intrinsic pathway. Other factors like fibrinogen, prothrombin, they are there for both pathways. So our focus will be on factor 8 and factor 9. Let me also add here, with factor 8 deficiency, the disease is called as hemophilia. With factor 9 deficiency, it's called Christmas disease. And when you suspect that these are the diseases in a particular individual, you will perform this particular test. So the test is also called as prothrombin activator generator test. Prothrombin activator will be generated by intrinsic pathway for coagulation, and it's a two-step procedure. Previous one was Quick's one-step procedure. This is a two-step procedure. Right. Now, in the prothrombin time, the tissue thromboplastin factor 3 was added to the plasma to assess the prothrombin activator formation by extrinsic pathway. Whereas in this test, that is APTT, it is to assess clotting by the intrinsic pathway. I have already mentioned it twice now. Formation of prothrombin activator by intrinsic pathway, and factors 8 and factors 9, which are exclusive for intrinsic pathway, those factors will be checked, and those factors will be deficient in the hemophilia or Christmas disease. Therefore, this test will be performed to check if the patient has either hemophilia or Christmas disease when the clotting time is abnormally prolonged. So, there is contact activation of factor 12. If you remember, I mentioned just now that how is intrinsic pathway triggered? Intrinsic pathway is triggered when there is contact activation of factor 12. And high molecular weight kininogen and prekallikrein, they are also required. So contact activation of these triggers the intrinsic pathway. So in this test, what we will perform is contact activation of factor 12, and we will be triggering the intrinsic pathway for coagulation. Partial thromboplastin. See, now the test is called Activated Partial Thromboplastin Time. So let's understand the meaning of this. What is partial thromboplastin? It refers to the substances or reagents which are added to the blood sample. We collect the patient's blood sample and we will be adding the reagents to the blood sample. So those reagents, those substances are called as partial thromboplastin. They are called as contact activators. Actually, they are called as contact activators. So they will cause contact activation of factor 12. What are the substances? Kaolin, silica or ellagic acid along with platelet phospholipids. But mainly commonly used are kaolin, silica or ellagic acid. These are called as contact activators, meaning factor 12 in the blood sample. You collect the blood sample of the patient and you will add these reagents, contact activators, to that blood sample. It is not a single substance. And how do they cause activation of factor 12? Contact activation of factor 12. Negatively charged surface which is provided by kaolin or silica or ellagic acid. That negatively charged surface provides the surface for activation of factor 12. So now patient's blood sample collected, plasma sample collected, and you are adding, as a first step, you will be adding kaolin or silica or ellagic acid. That's the step number 1. It's a 2-step procedure, as I mentioned. Okay, so plasma is pre-incubated with kaolin, silica or ellagic acid so that factor 12 is activated. There is contact activation of factor 12. Factor 12 has come in contact with these. These are the reagents that you have added. So factor 12 will be converted to 12A. You know the intrinsic pathway. 12A will then act on factor 11, converts it into 11A. Now after this step, no clot formation will occur further. The process will stop at this step, formation of 11 to 11A. And why is that? Because in the absence of calcium, coagulation does not proceed beyond this stage. So the procedure is stopped at 11A. Now the second step immediately is recalcification and addition of calcium to this sample that you have already created, mixing the reagent with the blood sample. Actually now you are adding calcium, so it's a recalcification of that sample. Factor 11A, which was already formed and the procedure was stopped there, now it will trigger further. 12A will act on 9 to 9A, and then in the presence of factor 8, prothrombin activator will be formed, and then the clot will be formed instantly, almost instantly. So you will see the time taken by the blood sample to finally form the prothrombin activator and the clot formation. So that's how the test is performed in 2 steps. So sometimes it is also called as Quick's 2-stage procedure. Time is noted for the formation of prothrombin activator and subsequent clot formation within next few seconds. Alright, the test depends on the platelet phospholipids. You know, intrinsic pathway for coagulation requires platelet phospholipids. So it depends on those. And then factor 5, factor 8, 9, 10, 11, 12. All these factors are actually being checked. That's fine. But our main focus is on 2 diseases which are in those diseases factors 8 and 9 are absent. So deficiency of factor 8 and 9 is the focus of these tests. Normal range of these, not these tests, just a correction of this particular test, activated partial thromboplastin time. And I've already explained the name. It is partial because these are the contact reagents. They are not full thromboplastin like in the other test, and they cause activation of factor 12, contact activation of factor 12. So the name is activated partial thromboplastin time. What is the normal range? 26 to 40 seconds. So note down here. In one step procedure, in 11 to 16 seconds, the prothrombin activator was formed. In the two-step procedure or by intrinsic pathway, it is taking a little longer, 26 to 40 seconds. And prolonged APTT is seen in these disorders. Thrombocytopenia, yes, reduced platelet count, and there will be prolonged APTT. And why is that? Because in thrombocytopenia, platelet count has become less. That means platelet phospholipids are also deficient. And as we saw, platelet phospholipids are required for intrinsic pathway of coagulation. Then, of course, the two diseases which I already mentioned, hemophilia, factor 8 deficiency, Christmas disease, factor 9 deficiency, and these two factors are required in intrinsic pathway for coagulation. All right. Well, even if you heparinize the patient, or there are circulating anticoagulants, even in those situations, APTT will be abnormal or prolonged. So that was the test, activated partial thromboplastin time. I've told you the basics of clot formation, which factors are required. Then we have seen how the tests are performed and then their clinical application. But in summary, prothrombin time is required, or it is done when you deliberately prolong the clotting time. So the patients in which the clotting has been triggered, in such patients you give drugs and you prolong the clot formation, and whether the drug is acting or not, to check that, you will perform prothrombin time. We saw the clinical conditions in which we require that, and particularly in which we give the oral anticoagulants, vitamin K antagonists. And in the case of APTT, it is checking the clot formation by intrinsic pathway for coagulation, and therefore our focus will be on factors 8 and 9, which are exclusively used in the intrinsic pathway for coagulation, and the deficiency of these factors is seen in hemophilia and Christmas disease. So when you suspect that the clotting has been prolonged in a particular individual and suspect either hemophilia or Christmas disease, you will perform APTT. So I hope with this you will not have any confusion regarding PT and APTT.